Dyscalculia is a learning disability in math. Dyscalculia is also referred to as arithmetic disability, arithmetic deficit, mathematical disability, digit dyslexia, number blindness, and math dyslexia. Dyscalculia can be identified when a student has difficulty counting, giving and receiving change, tipping, learning abstract concepts of time and direction, telling and keeping track of time, and the sequence of past and future events. It is important to understand what dyscalculia is and know the terms that go along with it. Dyscalculia means the inability to calculate. This is the most widely used term for disabilities in arithmetic and mathematics. There are two terms that branch out from the term dyscalculia. The first term is acalculia, which is used to refer to complete inability to use mathematical symbols. The second term is developmental dyscalculia, which is used to distinguish the problem in children and youth from similar problems experienced by adults after severe head injuries. Acalculia and developmental dyscalculia are not the only terms used when discussing dyscalculia. There are three main categories that a person can fall under when being diagnosed with dyscalculia. The terms are quantitative, qualitative, and intermediate. Qualitative dyscalculia is a result of difficulties in comprehension of instruction or the failure to master the skills required for an operation. Quantitative dyscalculia is a deficit in the skills of counting and calculating. Intermediate dyscalculia involves the inability to operate with symbols or numbers. Once we have become familiar with these terms, we are then able to make sure students are placed in a least restrictive environment so they can learn and understand the material that they struggle with. When a child is placed in a least restricted environment, this means they should spend as much time as possible with peers who do not receive special education. However, if a child's disability is so severe that supplementary aids and services can't be provided for an appropriate education, then the child should be removed from the general education class. The research on math disabilities are not as prevalent as they are for reading disabilities because having learning problems in math is quite normal. 3 to 7% of all children, adolescents, and adults suffer from dyscalculia. However, 17% of dyscalculia children are also dyslexic, and another 26% experience the effects of attention deficit disorder. Since the percentage of a child having both dyscalculia and another learning disability is higher than a child having just dyscalculia, then dyscalculia can be hard to diagnose. The only way to diagnose dyscalculia is by evaluation. Therefore, teachers should notice if their student is not able to follow sequential directions, have a keen sensibility of directionality when it comes to space, or recognize patterns. Teachers should also be on the lookout if students are struggling with visualization, estimation, deductive reasoning, and inductive reasoning. One of the biggest problems for a person with dyscalculia is understanding the language of math. Mathematics is a second language and should be taught as such. A lot of the terms used in math are not used in everyday language, therefore it must be learned specifically for mathematics. One of the best ways to help a child deal with their dyscalculia is by helping that child understand their learning disabilities. Don't keep the child in the dark. Talk to them about the difficulties dyscalculia can cause. Acknowledge their struggles and praise them for their hard work. Help them identify strengths and offer positive reinforcement. And help them combat negative self-talk. Accommodations are also a great way to help students with dyscalculia. Teachers can allow students to have access to a calculator during class and test. Teachers can allow the student to have extra time on a test. And the teacher can also provide or help find a tutor for the student who is struggling. Dyscalculia is not a disability that a person outgrows. Therefore, teaching a person to understand math and the language of math is the best way to help someone with dyscalculia. Teachers need to make sure they are evaluating their students so they can recognize the signs of dyscalculia at an early age to prevent a child from growing up and struggling with math into their adulthood.